My expertise concerns exercise physiology, everything that physical activity changes and brings to the organism. One of the main challenges for me is to translate that into practice by teaching young students in taking this up for their future medical career or sports professional career, bring it into general society and help general society to become more physically active. The effect of physical activity on health is very important. It can prevent many cases of diabetes, type 2 diabetes, late onset diabetes. It can prevent cases of cancer, it can prevent cases of cardiovascular disease. It's really a very major determinant of many chronic diseases. We should try to change things in such a way that everything is helping the population of engaging into physical activity. Even just a few minutes per day in somebody who was physically inactive before will have tremendous effects. We recently quantified that by asking inactive people working at the University Hospital in Geneva to take up using the stairs instead of the elevators. And just by that, which was an increase of not even 10 minutes effort per day, for the rest of the time physically inactive people, improved many risk factors. I'm responsible for an association that uses a popular road race in Geneva every year in December as a health promotion factor. It's called the Escalade race. There are about 25,000 people who participate now, and we use this event where children from the age of 6 until older people until the age of almost 90 participate while running through the old city, and use it as a health promotion vector. One thing we should be concentrating on in the future is thinking about our physical environment. The physical environment, our built environment, our urban design is a major determinant of our spontaneous physical activity levels. We absolutely have to adapt urbanism to make it adapted for physical activity. From Geneva Health Forum, I'll take, and from one of the sessions I just attended to, the fact that the problem is exactly the same everywhere in the world. However, the determinants of physical activity are not necessarily the same, and we have to take into account these cultural, social, and ethnic differences that play a major role. And one very simple example, in my country, in Switzerland, most people who change behavior and take up cycling to commute to health will do that because of health reasons, while the reason to take up cycling to commute to work while in an urban area in India will probably be because of not having enough funds to buy one's first car. And that's of course a big difference, and we have to devise and find out ways that help people become active, taking into account these different social cultural settings.